On behalf of the Institute for Innovation and Prosecution, I would like to welcome you all to our virtual panel discussion on prosecution, drug use, and public health. My name is Michelle Mason, and I'm a Policy and Operations Associate at the Institute for Innovation and Prosecution. This panel will be a deeper discussion on our latest publication, A New Approach, A Prosecutor's Guide to Advancing a Public Health Response to Drug Use. I'd like to take this time to read a land acknowledgement statement, which honors both the land and culture of Indigenous peoples. We want to acknowledge that the IIP and John Jay College are based in New York City, which is Lenapehoking, the Lenape homeland. We honor all of the Indigenous nations and their land with great gratitude and acknowledge the genocide and continuous displacement of Indigenous peoples. We also acknowledge the enslaved Africans whose labor built Manhattan during the colonial era and beyond. We acknowledge the harm inflicted upon Indigenous communities and people of color across the country, which inspires our ongoing work. It is now my pleasure to turn it over to today's moderator, Alyssa Mark Hayderi, the Deputy Director of the IIP. Thank you.
Thanks so much, Michelle, and everyone on the IIP team and our esteemed panelists today. My name is Alyssa Mark Hayderi. I'm the Deputy Director of the IIP. As most of you probably know, the IIP put together a working group of prosecutors, public health experts, and formerly incarcerated people. Some of those working group members are on our panel today. And we convened for 6 months regularly to discuss how prosecutors can approach substance use disorder and drug trafficking through a public health lens. Those conversations resulted in an action guide, a document full of ideas and information for prosecutors, as well as a series of videos. The videos they're informational, and they can even serve as an abbreviated and engaging training material for prosecutors. So we encourage everybody watching this panel to check out the web series after the panel and forward the videos to your colleagues as well. Just so you can get a preview of what those videos look like, we put together a very short compilation. So we're going to play it now, but we'll also drop it in the chat so that you all can see it in case there's any Wi-Fi delay issues. So Shauna, if you don't mind, just really quickly playing that compilation.
The need to arrest someone is not going to take us away from the 93,000 deaths that have just most recently been reported for 2020.
Mandates was being able to work on getting employment, right? Or being engaged in school and being an active member of society. But that's really difficult to do if every Thursday you have to go to court, or if every morning you have to call in to see if you have to come in and show up for some sort of report. It makes it hard to engage in employment and school when you know that there's this thing that you have to dedicate your time to. And if you're not dedicating your time to it, then that's cause for them to potentially discharge you from the program.
To make sure the person that we're dealing with never comes back. When as we evolved as prosecutors, we sort of learned the different ways to make that goal achievable, whether that be reducing the trauma of the arrest, connecting someone to services, and kind of focusing on the health issue that's causing them to commit crimes. Then they stay out of the justice system, they don't repeat, offend, and they get healthy.
People ask a lot of times if addiction or substance use disorder is a choice. And drug use may be a choice. We may choose to have alcohol on Friday night. When a person has substance use disorder, it's not a choice.
Thank you, Shauna. So that's just a taste of what the videos are like. These don't include Andre Ward and Sherry Boston's clips, who are here with us on our panel today. They kindly dedicated their time to create their own video training speeches as well. And so to discuss this project and really the issue of prosecution of drug-related crimes generally, we have highly distinguished panelists with us today. I'm going to very briefly introduce them, but their bios can be found on a link that we'll drop in the chat so you can look at them in full if you'd like. The first panelist we have today is DA Sherry Boston, and she was elected district attorney for the Stone Mountain Judicial Circuit in DeKalb County, Georgia in 2017. We also have today, to represent the public health aspect, David Cloud, who's the research director at Amend at UCSF School of Medicine. We have with us Dan Satterberg, prosecuting attorney in King County, Washington. He was elected King County prosecuting attorney in 2007. And last but certainly not least, we have Andre Ward, who's the Associate Vice President of the David Rothenberg Center for Public Policy at the Fortune Society, where he oversees advocacy efforts to reduce reliance on incarceration, promote model programming for incarcerated people, to change laws and policies that create barriers for successful reintegration and foster a just and equitable criminal justice system. So thank all four of you so much for being here with us today. To start us off, I think we should just start broadly and generally. And so David, you are a public health expert. You are one of the working group members in the IAP's project. You specialize in incarcerated populations. We hear to this phrase of applying a public health lens through which to look at the criminal justice system. What does that actually mean?
Okay, well, can everyone hear me okay?
Yeah.
Okay, great. So I think the first thing it means to me is, as someone who is a researcher, it means unpacking all the different ways that exposure to arrest, prosecution, incarceration, all facets of the criminal legal system, how that affects the health of individuals, their families, their communities, and populations, because public health is about population health. So that's unpacking, the different laws we have on the books. So the kind of draconian laws that we all know exist, and the war on drugs, all of its kind of different facets, and really trying to unpack how that shapes people's lives. The other part in the drug policy context is really about looking at, retribution and deterrence, and how laws that are kind of baked in that ethos, how they really, one, are ineffective, and two, really counterproductive for the goals they try to address. So for people who use drugs, fear, criminalization, stigma, all those things are intertwined. And it can really push people underground and have very kind of counterproductive effects. So those are two ways that I think about it. The other is in the context of violence prevention. And so when I look at the criminal justice system and I look at the conditions in a place like a jail or a prison, and you look at those environments, those are violent institutions. And I think, for prosecutors and people kind of on the front end of this, we have to be thinking about ways to keep people from going into a world that is harmful on so many levels. We don't have time to talk about that today. And I think lastly, like kind of more theoretically, I like public health because it kind of gives us a theory and a framework for getting much more creative and visionary to look at a world that really relies less on criminal justice system, like altogether, for addiction and drug-related harms, to build capacity and infrastructure for the things we know that make us a healthy society. So we've pumped so much money into, police, courts, and corrections over the past 5 decades, at the expense of our educational system, our public health system, our support for housing and things like that. And so it gives us a framework to say what's missing. How do we dismantle the harmful institutions and build up the ones we need to truly thrive?
Thanks. And I should have mentioned this at the beginning. I directed that question to David because he does have that background in public health, but if any of you wanted to chime in, you're more than welcome to. So I'll just pause and give anybody a second to add anything if they want before I ask my next question. No takers, okay. Well, Andre, I wanted to ask you, you've been very open publicly and with the IAP, with your personal experience growing up in East Brooklyn in the 1970s, your personal involvement in the drug trade and the criminal justice system, which we all very much appreciate. Can you just tell our audience, for those of you who haven't heard your story, just a little bit about that experience and from your perspective, the interplay of social and economic inequities that underlie drug markets?
Yeah, thank you, Alyssa, for that. And yeah, I grew up in the East New York section of Brooklyn in the 1970s. Much like my peers, we were entered the public school system that lacked resources and funding to really support our real educational development. the environment I lived in was impacted by inequities and systems, the likes of which were driven by fundamentally racism. And so growing up in that kind of environment, and obviously I had a mom who's dedicated to my well-being, to my moral upbringing, etc. But being raised by my mom and being pulled by the streets that at some point became like a surrogate father to me, right? I made decisions to get involved in a lifestyle that would counter, at least in my thinking, what the conditions were like in my environment, one of deprivation, one of inequity, and to pursue what I thought at that time was accessing wealth or material things, much of which I saw touted before me on television. And so I made those decisions that ultimately led me to be involved in the drug trade, that ultimately led me to be in contact with the criminal legal system. And so that's the extent of my involvement with the criminal legal system. I was sentenced to 8 to 24 years after my involvement in a drug-related shootout that led to someone's life being taken, for which I'm really remorseful for. But then, you know, as we've talked about before, and I think David raised these points too, their systems, their environments, the likes of which influences people's thinking and behavior. And I think when we talk about folk coming before prosecutors, I think it's important to note that a person shouldn't be treated as all they are is the crime, or all they are is the substance use that they were involved with that involved in being in criminal behavior. So I'll stop there, Alyssa, but certainly look forward to further conversation on this really, really important issue.
Thank you, Andre. I know it's hard to summarize your deep history in 2 minutes, but I appreciate you keeping it short. I mean, one question I wanted to ask is, you know, you said there are things, you know, prosecutors should approach their cases as those involving people, right? And people who are more than just the sum of this one, you know, possibly terrible act that they might have committed. Mm-hmm. So are there just, as somebody who's been on the other side, are there specific ways you think prosecutors can try to engage in that process rather than just viewing a case as the sum of one person's single action?
Yeah, we talked about that, Alyssa. I think what's fundamentally important for prosecutors to be involved with is engaging other stakeholders who looks at the person holistically. Again, the person is not the sum total of their crime, nor the substance use that they used, and or them being involved in criminal behavior at a certain age. There are factors and circumstances. We know that in the criminal legal system in particular, specifically on Rikers Island, what's happening now, over 40% of people have mental health disorders, serious mental health issues. And so a person has all kinds of traumas and other experiences that has shaped this person's experience, and especially coming from under and from experiences of inequity and oppression and systems that are driven by racism. A person's thinking is different. Their survival mechanisms are different. Their social functioning and engagement is different. And therefore, the actions that they will demonstrate will be not normal. And so the extension of that is a criminal legal system that's also not normal. But prosecutors can engage stakeholders like social workers. They can engage nonprofit reentry organizations. They can engage family members. They can engage advocates. So there is a collaborative effort in the decision process that goes into what should happen to this person. When you look at the whole person and the sum total of their experiences, you have a very different perspective on what kind of punishment, and I use that term in quotes, should be given to this person. In my thinking, alternative to incarceration, alternative to detention are certainly really viable programmatic opportunities for people rather than putting them in jails. Rikers Island right now is not a place for human habitation, we know. And we know that the world is looking at our country as abnormal as it relates to our criminal legal system, as we are the biggest jailer in the world. Rikers Island is a reflection of really where the unity of pain and trauma is housed. And where you have pain and trauma housed in an environment like Rikers Island, what will be churned out of that environment is people who have tremendous trauma because they're already entering the space with trauma from the inequities, systems of oppression, et cetera. And so you have high rates of recidivism because people are not being engaged in a way that would address them holistically. And I think a part of it starts obviously with not sending people to jails to begin with, but certainly on a prosecutorial level, developing interventions that involve stakeholders to support that person.
Thank you, Andre. I'm going to move to the elected DAs on the call. Sherry, as an elected prosecutor, why do you believe it is important for prosecutors to understand the history of drug laws in the United States? And how do you ensure the line prosecutors who work for you and the staff within your office have access to this information on top of all the caseload work that they're dealing with every single day?
Well, it's really important for prosecutors to understand that not all drug laws were passed to address the real issue of drug crimes. They were passed to get rid of the problem by locking up the problem. And we know that in order to get to the root of the problem, you can't just treat the symptom. You have to treat the cause. And we endeavor to ensure that all the members of our staff understand that each case needs to be evaluated individually. There is no cookie cutter or one size fits all answer. My staff members are educated on available diversion programs and alternatives to simply prosecuting and convicting people who truly need help rather than some level of punishment. So we train our prosecutors in our office to address, to understand that we're just not here to send people to prison. We want to address the underlying root of the problem, because if we address the underlying root of the problem, then we can save a person that has substance abuse disorder from committing future criminal acts, which ultimately makes the community safer. This idea that, we should just be jailing people for drugs does nothing to make us safer. I mean, we know that. We know that as a community. It certainly will never prevent people from using, drugs and or alcohol to numb their pain or to deal with their issues, to include mental health issues. But if we put in the time, effort, and resources into what can we do to address those underlying, perhaps socioeconomic, perhaps personal, perhaps mental health, perhaps substance abuse issues, then we can actually make a difference and ultimately keep our community safe.
Thank you, Sherry. I'm going to follow up with that in a little bit about, understanding that it doesn't make sense. Definitely doesn't make sense to put people in jail who are suffering from substance use disorder, but I'm just giving you a heads up. I'm curious to talk about your views on people who are selling drugs and trafficking drugs and who don't have any substance use disorder problems. But before I do that, I wanted to let Dan chime in if he wants to comment on anything that was said. And if not, I have a specific question for you, Dan, which is, what has your office done to change the narrative around drug-related crimes, both inside and outside your office?
Well, thank you, Alyssa, and thank you to the IIP for this discussion, because sometimes we think talking about drug policy seems like something we've been doing for a very long time, and haven't we figured this out yet? But coming out of COVID, and this year, we're going to set an all-time record for overdose deaths in America. Over 100,000 people will be lost to this. So it's time to start to think about it. First, I want to say about my glasses. I'm not wearing these to look cool, because either I'm already cool or it won't help either way. I had a procedure on my eyelids called a blastoplasty, and it's the horror show that is my eyes. Now, it's just in time for Halloween. I look like Count Dracula, but I will spare you looking at them yet, because I want to make a couple points. First of all, that the laws regulating illegal drug use in America have always been set by politics, have never been set with any nod toward public health, period, full stop. And secondly, the radical proposal is that when there is the intersection between criminal law and public health, that public health should win. And it has happened. And there's some things happening right now that we just need to step back and take a look at. And so I want to talk about a little bit about that as your historian. I've been a prosecuting attorney since 1985. And so I was in on the very first wave of the war on drugs, and I'm still here somehow. But I wanted to say a couple things first. One, harm reduction is our aspiration, and racial justice should be our motivation. And when you look at the history over the last 40 years of the drug laws in America, and recognize also that this happens in 3,000 counties. We always talk about the criminal justice system as a monolithic entity. The truth is that there are 3,000 counties, there are 2,300 elected prosecutors, and all sorts of people making up policy as we go. So that's both a strength and a weakness. But I want to talk about one moment when the intersection of public health and criminal law clashed, and public health won. This was 1989 in my jurisdiction in King County, when in the midst of the AIDS crisis, the public health department wanted to start giving out clean needles, clean works to intravenous drug users. And there was a moment, and it didn't last very long, because the prosecutor at the time, who I worked for, Norm Malin, he put his foot down and said, this is public health. This is to stop the prevention of AIDS. And yes, technically, giving out clean needles to someone who you know is going to use it to put heroin in their arm, technically that's a violation of the paraphernalia statute, but we'll never prosecute that case because public health has to win. All around the country, those same debates have happened. And I know there's still places in the United States where the DA is threatening anybody who tries to give out clean needles and clean works. But that's a pretty basic clash of those two things. But the politics around crack, that was the other thing that happened in 1985. And by the way, I highly recommend the movie called Crack. It's on Netflix. If you didn't live through that period of time, it is very accurate about everything that was going on, the fear, the stigma, the racism, the overreactions in Congress and around the country. But in our state, we did the same thing. We tripled the prison population in just 10 years, from 6,000 to 18,000 people. At one point, more than a quarter of the people in our prisons were there for a drug crime. And this sentences were jacked up. All sorts of tools like school zones and bus zones and things like that were in place, so that prosecutors had all sorts of tools to fill the prisons. And we did what we were told to do. But I want to fast forward to 2021, and in the context of coming out of COVID and in the context of fentanyl. We can't have this conversation without saying fentanyl, because it is the #1 drug issue in our communities now, and it's coming from China through Mexico in the form of poisoned pills that look like pharmaceuticals. It's in all of the they used to call it, they used to pretend it was heroin. Now they just call it down, DOWN. It's just, you can get a little flap for $15. You can buy for $15,000. You can buy a kilo and make $2 million by putting it in little flaps and selling it on the street. So it is a big deal. But the other thing that's happening, and not so quietly, but that we shouldn't ignore, is that cannabis has undergone this amazing rapid transformation from a banned product in most places to a regulated product in at least 17 states. And the entire West Coast, many of the large states, I don't know what the percentage of Americans who live in a state where you can go legally buy cannabis today is, but it's approaching 50%. So what does that mean for this conversation? Well, cannabis regulated, it's tested, you no longer have insecticides, paraquats, or any other molds or things that can harm the user. It's all regulated by the state. It is a safe supply. And I want to talk about the safe supply as we go forward, because I think if harm reduction is our aspiration, then a safe supply ought to be part of that conversation. And it's one of those things, as what's politically possible in your jurisdiction. I understand that, but it might be that in addition to fighting for supervised consumption sites and for drug testing and all these other harm reduction ideas, that we might want to consider in the wake of fentanyl, whether or not people who have an opioid use disorder ought to get a safe dose and not have to go out on the streets and play the roulette game of whether this dose is going to kill me or not. There are places where this happens. Vancouver, Canada has a place. Every morning, 150 people line up for their opioid shot from a trained physician or nursing assistant, and it's safe, and nobody dies in that group. Everybody else around in downtown Eastside Vancouver is dying of fentanyl, but not the people who get the safe supply. So if we really believe public health should win, then we ought to have all of these issues on the table.
Thank you, Dan. David, I'm going to put you on the spot, even though this wasn't one of the questions we talked about in advance, but just for those people watching who just aren't really familiar with the term harm reduction, or they've heard it, but never had it clearly defined for them, can you just, one sentence or two sentences, just explain what harm reduction is and maybe describe some of the proposals under that umbrella that Dan had mentioned, consumption sites. I think he mentioned drug testing. Those are things that some of our audience members just might not be familiar with.
Sure. Harm reduction, the simplest way to define it is meeting people where they're at. I mean, that's what you hear all the time. And that's really, it's kind of antithetical to the way that the criminal justice system has operated in the past. It's really about unconditional love and support and no judgment. And, you know, there's a range of interventions that fall under that umbrella. I think some of the more well-known ones are like syringe service programs. So those are programs that provide people with safe injection equipment to reduce, you know, their odds of getting a bloodborne pathogen. And then there are things like you hear about naloxone and overdose. So naloxone distribution programs that put naloxone in the hands of people who use drugs, who are the most effective and most likely people to save a life on the street, save their friends. And then there are things like safe consumption sites, which if you've been following the case in Philadelphia, there's been a long fight to get safe consumption sites in the US, but there's not one yet, at least, that is legally sanctioned. And that's a safe environment where it's, again, antithetical to something like locking someone up in a jail cell. It's a place where you can go, you can get a safe supply, you can meet a compassionate human who is there to not judge you, to understand the nature of opioid dependence, withdrawal, and to get you in a place where if you want to go a different route, if abstinence is something that you want to pursue, then there are tools usually that people can help you. And that's really a critical thing about harm reduction, is that abstinence is not the only answer. That is not the only definition of recovery. There are many tools that we have that people can leave, have jobs, have healthy lives, have healthy relationships, and on and on. And, you know, I think DA Sattenberg did a great job of giving a history and like the importance of public health winning. And you're starting to see a little bit of that trickle in parts of the country with legal changes to support things like syringe service programs and things that have just been missing from the equation across the country. I mean, I live in Georgia, I'm in Atlanta. I'm on the board of the Atlanta Harm Reduction Coalition. We've been running a syringe service program for 25 plus years, but it's only been legal for about 3, you know? So I think we're way behind the mark with our law. Safe supply is really critical. It's one that I think makes people say, oh, you're just, you know, you're enabling people. But the only thing harm reduction really enables is saving lives and compassion. And so we just really have to flip the script on getting people to understand what harm reduction really is about and the evidence base behind it for keeping people alive and respecting their humanity.
Thank you, David. Andre, I wanted to talk to you about, I think there's a growing consensus in the country. It's not 100%, but a growing consensus in the country that we can't be locking up people with substance use disorder, that perhaps harm reduction is the way to go for those who are using drugs and giving them an alternative, like David said, to abstinence. But I think where a lot of prosecutors get wary and nervous about these conversations, and when you start talking about drug trafficking, and that is because of the link, or at least the perceived link, between drug trafficking and violence, right? And so, you know, we know that most incarcerated people serving a sentence for a drug offense, they have no current or prior convictions for a violent offense. And we know that more than 1/3 of the total have been convicted only of drug offenses. And so what information do you think, Andre, prosecutors should gather about the accused when they're looking at a drug-related case, whether it's, you know, not just possession, but say sale, or sale connected to a robbery, and they're looking at that case with the assumption that by putting that person in jail, they will be preventing future violence?
That's a really good question, Alyssa. And I think there's some intersectionality between someone who has a substance use disorder committing a crime and someone who distributes drugs, and that is a form of a crime. I think the intersectionality and relationship between the two is that when you look deeply into each of the lives of those persons for whom I've just described, a lot of the drivers of their behavior is pain, is trauma, and it's going back to what I mentioned rather earlier, is the very systems that each of those persons are under, one of which uses substances as a means to cope with the pain and trauma and the impact the environment has on that person. The other uses a means of selling drugs as a means to cope with the lack of access to resources and support so that they can access opportunities to be successful as well. So there is some relationship there that when you look fundamentally at some of the behaviors that undergird like why people do what they do, you'll see that oftentimes it's those very systems that we spoke about. So again, there are two things that we're looking at here, especially from a public health lens. We're talking about the systems, and then we're talking about the human being, right? The individual, and how does one impact the other? And so in short, that would be my answer, Alyssa, that the person who commits a violent offense in relation to some drug-related kind of like situation is seeking to validate themselves in some way, to access some things in some way as a result of the environment that they're in. Similarly, someone who uses substances or has a substance use disorder is just seeking a means by which to cope with dealing with the environment and its impact on them.
Thank you, Andre. Oh, Dan, I should see you're raising your hand. Go ahead.
I did, and you can't talk about violence and drugs without talking about the impact that the United States decades-long prohibition policy has had on our neighbors, on Latin America, Central South America. To prohibit something where the demand for the substance is so high, where the profits are so high, invites violence, invites corruption. And we have America's thirst for drugs and the fact that it's so profitable has enriched drug lords, has corrupted governments, has really made life unlivable in so many countries in Central America. And we have to own that, and we haven't owned that. But that's part of the damage that is done, not just to our own people, but to our entire hemisphere here. And it's just, we can't talk about this without acknowledging that as well.
And DA Satterberg makes a very good point, I think. And the other part of it is too, when we talk about violence, right? Violence is a learned behavior, at least from my vantage point. I don't think there's a genetic basis to someone's violent acts necessarily. And when institutions intentionally and historically have deprived people access to equity and resources, I would venture to say that is an act of violence against those people. And when you have violence upon you, there's a tendency of you to act out in a way that's violent too. And so I know, as I mentioned before, Alyssa and others, our district attorneys, our prosecutors had a very difficult job to do, but looking very closely at the systems and like DA Satterberg has articulated, understanding the history, I think that's critically important. When you understand that, you can really engage how we're dealing with people with substance use disorder, and by extension, people who are distributing drugs and involved in violent cases. You can deal with them differently.
And I don't think we can have this conversation without also talking about the intersectionality with race. And we know that drugs in the Black communities have been treated very differently than drugs in the white community, whether that's use and substance abuse, or whether that is how we treat people that sell. And so if we don't acknowledge that those things have been existent, and historically that is where we have delineated violent crime versus nonviolent crime, then we're doing a great disservice to the conversation. Because ultimately, this notion that we want to categorize some people as having a medical crisis, which we know over the last couple of years, as we've had these conversations, particularly around fentanyl, right? Where we have folks in and opioids in traditionally white or rural communities where it's all of a sudden it is a public health crisis, right? Whereas we know there was a time in the inner cities and in urban areas when we had the proliferation of crack cocaine, that was just a drug violence problem. The reality of it is it's all a public health crisis. It always has been. It's just the idea that we weren't willing to call it that, and we weren't willing to address the issue from a public health lens until it was affecting a different category of people in our country. And that is the reality. So the fact that we're even having this conversation today and talking about harm reduction, talking about substance abuse disorder, talking about the issues is driven not by what happened in the 90s to many African-American communities in urban areas, but really driven by what's happened more recently with opioids and fentanyl and other things that are affecting communities that weren't Black and brown.
Yeah, and DA Boston raises a good point too, and I'll just share very briefly. I remember reading in Andrew Hacker's book, Two Nations, right? One Black and one white, separate but unequal. And he raises some of those issues in his book when he talks about that. And when we think about even the arrest process, right, and how communities are policed, right? In one instance, right, their police are in communities to serve and protect. And then in some other communities, it's really just about law and order. And that determines oftentimes like how people are treated when they come before you, DA Satterberg and DA Boston, right? If they are approaching it, law enforcement that is, from the perspective of serve and protect or from the perspective of law and order. Invariably, people of color are experiencing the engagement with law enforcement from the vantage point of law and order. And therefore, when police officers engage people of communities of color, it's from that perspective, and they oftentimes end up in contact with the criminal legal system far more often than they ever should.
Thank you. DA Boston, I think I'm glad that you highlighted the issue of race, and that's something that we can't ignore in this conversation, as with, frankly, any conversation about the criminal legal system, but especially the public health one. And then for those of you watching the public health action guide that we put out, it talks about race, but also at the end, there are really good resources and links there for further information and materials about the history of race and our drug laws, and then continued racial disparities in the way we treat drug cases today. So just wanted to put that out there for those of you who are watching. David, we had a question in the chat that I wanted to ask you because it was specific for you. And it says, for purposes of this emphasis on public health, what are your thoughts about addressing the social determinants of health? So things like housing, hunger, mental health care, before an incident of criminal liability. So I guess before a crime has even occurred, as a means to just reduce our dependence upon the criminal justice system altogether. And this isn't in the question, but I guess one follow-up question to that would be, again, most of our audience are prosecutors. So how can prosecutors prevent the person even coming into the system in the first place, when really that's when most prosecutors get involved?
Sure. Well, I mean, I think, first off, I just agree with that in principle, and that's why we do this, right? It's the social determinants of health that, it's come up earlier. Andre mentioned this, and it's about reckoning with history, and not just over the past 50 years, but the past 400 years. And the inequities that exist in education, housing, all those things, like we have the resources to deal with those. We just choose not to as a society. And we've chosen to pump that money into a carceral system. And so providing people all of those things so they don't have to involve the criminal justice system and all, that's ideal. And in terms of what prosecutors can do, in my mind, I think it was Andre who mentioned this too. It's about forming those partnerships and using your platform to stand up and use to get a different political narrative out there about your responsibilities as prosecutors, to fight for the types of laws, whether it's safe supply, syringe exchange, safe consumption, those types of policies, to fight for and to educate people who a lot of their politics is based on fear. I mean, it's the fear, the racist kind of crack narrative is still alive. I mean, it really is. I mean, sitting here in downtown Atlanta, I know if you go up in about 8 miles from here in the suburbs, that's what people believe still. A lot of them anyway. And I think we have to have people who are in positions of power like prosecutors to say it's not like that, and that's not the way it's going to be, and take a risk. I mean, you know, elections are risky, but I think it's building those relationships and finding ways to get resources and support, and standing out on a limb like, you know, DA Boston and DA Soderbergh are doing right now, but to do it in kind of the public arena too. And then, you know, more, you know, I think more directly, it's like, it's coming up with those interventions, it's coming up with different programs and using their power to just create as many kind of opportunities and interruptions to prevent people from going deeper into the system, and just using that power very kind of carefully and wisely.
Thank you. Dan, go ahead. Saw your hand.
Sure. So the thing that prosecutors have that very few other elected officials or mere mortals have is discretion. We have the superpower of prosecutorial discretion. And so I can decide where to put my resources and where not to. I can decide as the elected prosecutor to not prosecute people who are caught with small amounts of drugs, which is a policy that I instituted in 2018. And yeah, some people are still mad at me. They blame me for homelessness. They send me pictures of needles on the streets. It's all my fault because these people aren't in jail. But I know, and people who are close to the system know exactly what happens to those cases, which it takes a year or more to resolve a tiny possession case, and there are multiple warrants issued, and we basically jack people around for a long time and then offer them nothing at the end of the day. And so I decided not to do that. Now, it's whatever is possible in your jurisdiction politically, but we were able to also collaborate on the LEAD program about 12 years ago, which was an immediate arrest diversion program. It was allowed the police, when they arrested somebody, to immediately call a case manager, and they'd send us the case, but we wouldn't file it. And as long as that person engaged, we would never file that case. That has since evolved. LEAD has become kind of a major homeless provider of service here for us, as well as people with significant behavioral health issues. But I mean, we do have that power as elected officials to figure out how to use our resources. And I'll say that coming out of COVID, most major jurisdictions have enormous backlogs of serious violent cases that are waiting to be tried. And so if the criminal justice system was ever a path to treatment, it isn't today. You have to get in line for years behind all of these murder cases that we've got. And so this is really the good time for prosecutors to be exercising their discretion and to build the alternative. I mean, these cases come to us not because we're the best option, they come to us because nothing else exists. So you have to build your LEAD program, you have to build something to refer people to. I think all that the voters who elected us want is they want us to respond. They don't want us to ignore it and walk away from the tragedies of substance use disorder. They want us to respond, but it doesn't have to be with locks and keys, and it doesn't have to be with prison sentences. It can be with an engagement with community partners who can provide those kinds of services. So we all have that power. You just have to use it if you think you can.
Yeah.
I also think,
go ahead, DA Boston.
I was going to say, I also think that we need to invest in really a communications platform to educate the greater public on what harm reduction looks like and how we can address drugs through a public health lens. Because it's like we throw out all these things when we talk about safe injection sites, when we talk about safe needle programs, when we talk about the things that will make our community more safe by addressing folks outside the criminal justice system and addressing their real issues, people have distorted ideas of what that looks like because they've never seen it. And frankly, I will say to you, when I talk to people in my community, and these are Black and brown communities, they're like, oh no, we don't want that in our neighborhood, because their perception of what a safe injection site looks like looks eerily similar to abandoned, burned out row homes where people are allowed to like live and do drugs and get no assistance and help. And guess what? If that's what a safe injection site was, I wouldn't want that in my community either, because that's basically pushing people to the side. But what we need to do is make sure we can find a way to show all sides of our community what a public health lens looks like. And I will say I was really grateful that I got to go to Portugal, and Dan was on that trip with me, where we got to really see firsthand what these types of things look like. And it changed my perception, because I'd never physically seen what a public health approach to these specific issues look like. I understood them, but I didn't physically see them. And when you do, you go, aha, it makes sense. Just in the same way that jail wasn't the right place for mental health issues, right? We understand that a reputable hospital with treatment, with doctors, with medication to stabilize people is important. And this idea that we're not offering that to people, and more importantly, sometimes we're shoving them into programs and accountability courts that expect absolute abstinence, is a disregard to how public health views these issues. Because anybody that's ever had an alcohol problem, a drug problem, or even tried to quit smoking cigarettes knows that it's absolutely not a cold turkey proposition. It is something that you will have to live with for the rest of your life. And every time there's a stressor or something that happens in your life, you will have to have, the base and support to do something other than a drug, an alcohol, or smoke a cigarette to get through the situations in life that are going to continue to be thrown at us.
I just wanted to add that the thing that stuck out to me in our trip to Portugal to see how they dealt with their problems, they had armies of street outreach workers, and we got to go out with them on a couple of afternoons, and they would go into the areas where people use drugs, and they would hand out kits that with not only clean works, but with wound care and fresh water and other things that people just needed so that they didn't do more harm to themselves than they already were doing. And I have mixed views about the supervised consumption sites. I've been to the one in Vancouver, and it works there because in that particular neighborhood, there's an estimated 20,000 intravenous drug users who have a 5-minute walk to this place. Most in my county in Seattle area, 2.2 million people, our intravenous drug use is so diffused throughout the county, you wouldn't know where to cite a single place, and it wouldn't be worth probably the political blowback. But street outreach workers can have the same impact on people and help alleviate a lot of that suffering that goes on. So it reduces the stigma. And then when the person is ready for help, they know where to go because they've already built a relationship with the person who comes out and hands out bottles of water and just has a conversation with people who are struggling. It is not a lifestyle to celebrate. It's not fun for anybody who's homeless and addicted to drugs, and they just need to know that there's somebody out there who cares. And so that to me is a worthwhile investment that I will be pushing for more of in my community.
Thank you.
Yeah.
Andre, I want to give you a chance because I know you wanted
just
to
very,
say
very
something.
briefly too. I'm really happy that DA Satterberg and Boston were able to go and visit and to have that transformative experience by what they witnessed. And I think that experience in and of itself really speaks to how that country decides on where they invest their money. Unfortunately, our country decides to invest their money in building up the carceral system. I think David spoke about that. And so I think it's important to note where we decide to invest our money to build the capacity of human beings will determine the fate of our country relative to how we engage people with substance use issues. The other part of it too is, I think, to DA Satterberg's point, right? Or I think DA Boston raised it about the communication arm that we need to really build up. And I think that should be comprised of advocates, people who have been impacted themselves, former substance use, people with substance use issues, going to the community and educating them. not just about harm reduction in and of itself, where I think there's tremendous value in educating people on that, but also helping people to understand politically, right, historically, that context. Because people oftentimes in communities of color may not have a comprehensive understanding of the historical experiences that the communities that they live in have experienced and how that has shaped people's thinking and behavior. And sometimes when people are educated about things historically, right, they have a different perspective, right, and how they look at things. Rather than, I don't want those people around me, right, they understand like why, right? It's almost like this restorative justice approach. Oftentimes when people are harmed by someone, for example, a lot of times they want to know like, why did they harm me, right? And then when they sit down with the person and the person explains to them some of their history, like what they've been through, et cetera, it doesn't ameliorate circumstances necessarily, but the person who was harmed could say, okay, I understand why you did what you did. And that sometimes leads to healing. That sometimes leads to building community among people who are having similar experiences.
Thank you, Andre. You mentioned restorative justice, which is something that we covered in the working group and the action guide. These questions are more for DA Satterberg and Boston. Restorative justice, we all know it's a promising movement that talks about delivering accountability for harms, but also promotes a process of healing for both the victim and the accused. Generally, though, most prosecutors are only using restorative justice for nonviolent crimes. And so my question for the DAs is, what are your thoughts on using restorative justice for, say, drug-related cases involving violence? So the person who commits a robbery, say with a firearm, because they need the money to purchase drugs for personal use. I'm not entirely familiar with your policies, but I don't know if you've had cases like that, and whether or not restorative justice is something that you think prosecutors should be open to in those types of cases. So I'll start with Dan.
Well, we don't currently have a program for armed robbery. I mean, I think that there could be a place for it. We're now doing a whole bunch of resentencings in my state for people who got 3 strike sentences for robbery as one of their offenses. So 10 years later, they're coming back and being resentenced, and we're in touch with the victims, and many of them are open to that sort of thing. I think right away when it happens, there's still a lot of fear and mistrust and concern about the sincerity of the participation of the person who's not yet been sentenced for that offense. So it's something we need to build. Now, in my office, we're doing a first of its kind, as far as I know, diversion program where we're paying community nonprofit partners to receive cases from us that involve, in the adult system, it's the first felony that a person is facing. And we're using public money to pay victim loss so that we take that off the table right away. And that's a holistic justice approach, when you can make the victim whole, not make them wait 20 years and maybe they'll get $5 in the mail one day for the $1,000 loss. The average felony loss is about $1,000, and most Americans can't just suck that up. Most people don't have those resources, and the demographics of crime victims are very similar to people who are perpetuating the harm as well. And they don't have a lot of money. So we're going to make the victims whole, and we're going to send that individual who caused the harm into the community to be surrounded by community nonprofits who can come up with their own system of accountability. It doesn't require the victim to sit with the person who caused the harm. That's one form of restorative justice. But another form, I think we should look at this broadly. There's not just one orthodoxy behind this notion. It's how do we make victims whole and satisfied as soon as we can? And how do we involve the community in the resolution of some of these issues? And so our program, which is going to launch first thing next year, we'll put about 1,000 cases out of my office into the community, pay people for the work that they're doing, because community nonprofits need to be paid the same. It's a public safety job. They need to be paid for that kind of work. Victims need to be made whole. So we'll come back in a year and tell you how that's working.
I just wanted to, in response really briefly to DA Satterberg, Alyssa, there is a program in New York City, an organization called Common Justice, that's headed by Danielle Serret as the executive director. And in her seminal work, the book Until We Reckon, there's a real analysis around addressing those things. But Common Justice is the first alternative to incarceration victim services program in the country. And it's something maybe to look at, DA, as a really effective model in dealing with not only just the courts and jails and et cetera, but the community and building that in some way. So I just wanted to add that very briefly in response to what DA Satterberg said.
Thank you. DA Boston, I don't know if you wanted to comment on the restorative justice in the context of potentially violent crimes.
Yeah, absolutely. And so what I'll say is, we've had to really dig into these issues real specifically in my office, in part because we are a felony only office. So in order to think about how we change our approach, we don't have the low hanging fruit of misdemeanor drug offenses or lower level offenses. So for us, everything's about, we're dealing with what people consider to be the most serious of felonies. So we are in the process of integrating restorative justice for felony offenses. We have a diversion program that we started in my office called Stride, where we are allowing, and I was just pulling up some of the offenses that we allow into our program. And traditionally, these are not offenses that people would be used to seeing in a diversion program. We're doing possession with intent to distribute. We're doing robbery by snatching. We're doing possession of a firearm with intent to distribute drugs. All of these things are coming into our program. And what we've seen with our participants is that when we are looking at the underlying resources and providing them with job placement, career skills, counseling services, drug and alcohol counseling services if they need it. When we're providing those wraparound services, we're not seeing those folks recidivize and come back into the criminal justice system. A part of that program oftentimes does include a restorative justice piece because it is a great tool. And it's not only focused on healing and accountability for the victim, it's really also for the offender as well. For the offender to take that accountability for the harm that they have caused at the hands of another person who, in many circumstances, we talk about the victim of that crime is not only hurt, I guess, emotionally, but oftentimes financially, because when you rob someone or carjack someone of the, low or the old model Honda Accord, which is the only car they can afford to get to their job, and you take it from them, that person is feeling even more consequences because it's now affecting their ability to get to work and care for their family. So restorative justice can be that level of accountability that the offender needs to have, and for a victim to understand that sometimes they can realize that the person that has committed this crime against them isn't a bad person. It's just someone that's dealing with some of the same circumstances in my community that our victims are, because we find that many of our victims are defendants and many of our defendants are victims. But if someone is in recovery and able to accept responsibility, we do want to give them the opportunity to engage in restorative justice because we believe that it will move us forward. And so we are actively seeking cases where this is an option, where we feel like it's appropriate at the appropriate time under the appropriate circumstances, where both the harmed individual and the person harmed are open to it, and we can produce some really great and transformative results when we do it.
Thank you so much, DA Boston. We are out of time. I'm sorry, folks, I didn't get to all the Q&As, but this was a really great discussion. We're so lucky to have all four of you working on these issues, pioneering these new programs and initiatives. So thank all of you for being on the panel today. Thank you to our audience for sticking with us through the hour, and the IIP team, obviously, for helping us put this together. So it was great seeing you, and thanks again, everybody.
Thank you.
All right, take care.